Namaste.
How are you,
I'm fine.
ma'am? When you are in responsibilities as a minister, Kerala faced COVID
Okay.
problem, COVID issue.
Yeah.
So in that time,
Uh,
UNO invited you.
uh,
How is that feeling, ma'am?
yes, there are so many struggles we have to conduct at that time.
Hmm.
Um, and UN invited me to speak in the General Assembly at that time
Yes.
as a health minister in Kerala because Kerala during this crisis, Kerala win all these crises in a very good manner. And that every crisis we knew that we have an opportunity,
Exactly.
and we had very good planning and implementation to prevent
Hmm.
this infectious disease and also non-communicable diseases.
Hmm.
We have very good campaign to control the non-communicable diseases. Our slogan was to prevention is better. We have to prevent the disease first, both the communicable and non-communicable diseases. To prevent communicable diseases, to prevent infectious disease, we have to control, we have to contain the prevention, and to break the chain of the chain of the infection. So we have very good plan for that and worked hard, and we can control the infection of the COVID. Not only COVID, but there was another challenge, that is Nipah virus.
Nipah, yes, exactly.
There was a Nipah virus outbreak before COVID.
Sorry for the interruption. Kerala is a small state.
Yeah.
All India and all world scared by COVID.
Yes.
But small state like Kerala, how you managed?
Kerala is a small state with great population, We are more vulnerable than other states in front of a pandemic or a infectious disease, because we have mainly three vulnerabilities. One is that ours is the thickly populated state. Our population density is 860 out of 1000 kilometer. Out of 1 square kilometers. And in other places in India, it is 430 only.
Almost
So
double.
we are almost double. We are so thickly populated, and we were afraid that if a infectious disease came to Kerala, the possibility of the spreading of the infectious disease more than other state. Our second vulnerability is that the old age population is high in Kerala. It is almost 20% of the total population. And above 60, most of the people have some lifestyle diseases. We are calling it comorbidities. And if a person is comorbid, the chance of mortality is again increasing due to the infectious disease. So we have to protect this 20% above 60 peoples more than anything. That was the vulnerability. And vulnerability number 3, that is the transport system in Kerala is improved a lot. We have the small state have 4 international airports there.
Exactly.
Seaports are there, and by road we are traveling. All the people are traveling up and down or here and there, and also due to the enhancement of this transport system, people can move from one place to other place easily. And Kerala become a urban state, no rural area, we can say. Rural and urban mixed areas are there. So that also increases the possibility of the spreading of the infectious disease. So we are more vulnerable because we cared very much more than other states. We were aware of this thing, and we started our preparation. COVID started first in Kerala, in India. Just after the Wuhan, COVID came to Kerala. That was the first incidence in India. That was 2020 January. 2020 January, I was health minister, and I happened to read some news in some newspapers that a potential virus is spreading in Wuhan, China. I feel something in my heart that I feared that it will come to Kerala, because in Wuhan there is a medical university and so many Malayali students were studying there at that time. And I remember that previously some students came to me for registration in Kerala after their completion of medical degree there. So at once I called my health secretary and told him that there is a potential virus in Wuhan and there are so many Malayalis there. They will return to Kerala definitely. And if anyone is infected, they will bring the virus to Kerala also. The incubation period is 14 days. So we cannot understand who is infected within the 14 days. So we started at once. We opened the control rooms in Trivandrum, the capital, and also we insisted all the 14 district to open control rooms in the district also. We trained some health workers and we put them in airport to check whether anyone is coming from Wuhan or not, to examine them.
Before
COVID.
Preventing, for the prevention.
Yes, prevention, for prevention. And we started the surveillance and in the airport. And luckily, we can identify the 3 students who returned from Wuhan at once in the airport itself. And we kept them in quarantine and examine them thoroughly. The COVID will come outside, the virus will come, the symptoms will come outside within the 14 days, you know. And after 1 week, the student showed the symptoms, fever, cough and other thing, but they were under our custody, health department's custody. And we sent the swab to laboratory and tested. On January 30th, one student was tested positive for COVID. At that time, they were under our
first
custody.
case in India.
First case in India. And we isolated that student and treated well. Then after 1 or 2 days, the other also, we found that student is also infected. And 3 students, they were infected. But luckily, we caught them. We didn't send them to the family or neighbors and prevent the infection from them. And we contained that infection there. So the spread, we can break the spread of the infectious disease, the virus. So the first experiment was a success in Kerala. And then we started surveillance everywhere, in seaport, airport and in road. We are checking the vehicles, etc. Someone laughed at us at that time. What are you doing? You will not come to Kerala. Why are you staying in the airport with a gun? Not gun, the temperature measuring machine. But we didn't heard their this ridicule or like that. We move forward with our planning. So, 2020 December, COVID spread all over the world, you know. And Italy, USA, UK, everywhere. What is the result you can find out from the chart, from the data? 2020 December, when we examine, in New York, America, more than 60,000 people succumbed to death. But in Kerala, it was below 5,000. 5,000. Fantastic result, because Chief Minister and all the department involved in this COVID treatment, you know. Our government declared that COVID treatment will be completely free. Free treatment to everybody without the discrimination of rich or poor. And Chief Minister called all the private hospital management. We had a meeting and asked them to give some space in their hospitals, some isolation room, some ICU beds, etc. We asked them to give it, and they allowed that bed, and we were increasing our health system capacity. And in government hospital, we increased the number of beds each and
during
every
the COVID
day.
period.
That COVID period, each and every day we were buying new beds and new cots and new ICU machines and everything we collected and installed in the government hospitals. Our slogan is to keep the virus potential under the health system capacity threshold.
Mm-hmm.
We never allow the virus to come up the health system capacity threshold. And we were working all the time, day and night. Our doctors, our nurses, and our workers, our gram panchayats, everyone, and our COVID volunteers, everyone were working. So we have the fantastic result. But someone suspected that how is it possible to have such a result? They said we are suppressing the death.
Some people
Yes,
told that. Some media
told
also
that.
told that.
Media told
You
like that.
suppress the-
We are not giving out all the deaths.
Yes,
You know.
they told.
But luckily, in 2020, there was an excess death analysis conducted by the center. And in that excess death analysis, it shows the picture. What is meant by excess death analysis? What is the death rate in death rate before the COVID period? And what is the death rate during the COVID period? Total death. In 2019, the death rate was more, it is more than 2020, you know. 2020, the death toll decreased in Kerala.
How it is?
And throughout the world, I think only 5 places got this result. Cuba, Vietnam,
Okay.
Korea, and the New Zealand, and Kerala.
Kerala.
You know, not India as a whole,
Exactly.
in Kerala. That shows, that excess death result shows that we are not denying, we are not suppressing the death rate. If we are not announcing all the death, that will go to the general death list.
Okay.
Because death registration in Kerala is total 100%, and that death will go to general death list. But it is not increasing. 24,000 death was lower in this 2020, you know. How is it happened? It is because of this strong quarantine, isolation, and examination and surveillance, etc. throughout. Even the local self-government is acting as a government as a whole to control the death or to decrease the death in their panchayat. They started COVID first line treatment center, COVID second line treatment center, domicile care center. Some of the convention centers were converted to temporary hospitals, etc. And we increased our oxygen production also. The oxygen was sufficient for us during the COVID first wave, that is in March, April 2020. The whole world is facing the oxygen scarcity. Even in our country, in Delhi, the people were not getting proper oxygen and dying because of the falling of the oxygen saturation. But in Kerala, we have enough oxygen at that time we had. But we fear that if the COVID infection increase according to the prediction, the IIT and other institutions predicted that it will go up to 25,000 or 50,000 per day. At that time, what shall we do? We think. We thought at that time. And we called the oxygen manufacturers, health department and industries department together, called them. CM asked us to join hand in hand with the industry department and health department, and we called them. We asked them what is the possibility, inquired what is the possibility to increase the oxygen production. That is in Palakkad district, Kanjikode. And they said there is a plan which is not completed now, and we asked them to complete it as soon as possible. Government give all the facilities, all the aids to complete it. At once they completed, within 2 months they completed the plan and produced more oxygen at that time. And we collected enough oxygen cylinders. We made oxygen pipelines in the hospital to the isolation ward. We were implementing these things, we were constructing these things side by side of the treatment. Not only the treatment, but we were improving the health system as a whole. That is why, and because of this break the chain, we started a campaign called Break the Chain, SMS campaign. That means soap, mask, and social distance.
Oh, SMS.
We started first it. So using soap or sanitizer, we have to wash hand. And that was the protocol.
Oh, yes.
And we asked them to wear mask. Every people in Kerala were wearing mask at that time. and also keep social distance. We strictly implemented this thing with the help of the public. We give awareness to the public. We taught them, our nurses, doctors and health workers, even asha workers taught the people. Continuously we were working for the awareness creation, treatment and isolation, and increasing the capacity of hospital. Side by side we were doing all these things. Because of that, 2020 December we have very good result. The death rate or the mortality rate is very low at that time, very low. I think it is the lowest among the countries,
Country,
we
yes.
can say so. But 2021 the situation changed a little bit, because 2021 our assembly election was announced at that time, new election. So very political parties have to organize people to for their campaign work. And at that time all assembled together, and so many meetings, hall meetings and outside meetings, etc. At that time a little bit infection happened, and some more infections happened at that time, and the death roll increased a little bit, but not as a whole. We are the lowest now. But up to 2020, because of this planned work, it was very fantastic, because of this break the chain campaign. Then all other states accepted this break the chain campaign also. We started it first. We are proud of that. And we have a protocol, standard operating procedure, everything we made ourselves, because COVID came in India first in Kerala. So we were the people to make some protocols, and we made it. Same was during the Nipah period also. So the hard work and the teamwork and proper decision at proper time, that was the thing behind the victory, you know. But someone is criticizing that it is not true like that. Anyone can examine all the result or all the data. We are frankly saying that was a fantastic result. But UN and other agents noticed that. I had an interview with Laura Spinney in Guardian newspaper, which is in UK. And Laura Spinney asked me to have an interview. And Laura Spinney is a famous writer and journalist, you know.
Yeah.
Yes, we have an online interview. And she asked, what are you doing there? I explained everything, what this and this we are doing like that. And she was very inspired, and she write an article in Guardian paper that, and give a headline that Kerala's rockstar health minister coronavirus slayer, like that. Our opposition also ridiculed. They misunderstand that rockstar minister. They one of the opposition leader thought that it is rock dance they are saying, and he become foolish saying like that. But we got the appreciation like that. I am saying that the actual heroes are behind the curtain.
Exactly.
It is not my own work. I was health minister at that time. I organized and I gave leadership. But our government, our chief minister and the cabinet as a whole decided these things and give me support. That is why I can work as a health minister satisfactorily at that time, you know. So
Actually,
yeah,
one question
yes.
is, actually I visited Kerala 2 years ago. I surprised one thing.
Yeah.
In front of government office,
Yeah.
there is a queue.
Yes.
All people are upper middle class people.
Yes. Yes.
So how Kerala health system is different from other states in India?
2016, we started 4 missions especially. One is Harita Kerala mission. It is for making Kerala green and reducing the carbon dioxide, and also making Kerala clean. That was to remove all the waste. That mission especially for that. And education improvement mission. That project wanted to make public education system strong and modern. Oh, so we demolished all the dilapidated buildings in the education sector, and we built beautiful buildings and also smart classrooms, etc. It need huge amount of money. We cannot use money from our budget share or tax share getting from the center. That is a meager amount, you know. But we started a project from KIFBI, Kerala Infrastructure Investment Fund Board, and we borrowed off budget borrowed money from some financial agencies, that is long term loan, and we decided to invest for the capital investment as capital investment. Capital investment. During COVID time also we did this thing, and the education system got some money from KIFBI, and they started to build the schools most modern. And one mission is building a home for homeless peoples, that is life mission. We built more than 5 lakh houses in Kerala through this mission. And the last one, that is to health sector, that is Ardram mission. Ardram mission is intended to Ardram means making lovely or like that. Ardram, and that mission is especially for health. And Chief Minister asked me to make a project for Ardram mission, and I called all the health specialists in my state, discussed it together, and we have a very good project after that. And in that project, we decided to improve all the sectors: primary, secondary, and tertiary. In the primary sector, primary health centers are there, and the secondary, there is Taluka hospital, district hospital, etc. Tertiary, medical college. So we decided to get some fund from KIFBI. If we want to get fund from KIFBI, we should have proper project for that. So our department at once started to make projects, detailed project report, plans, etc. And we decided to convert the primary health center to family health center, to improve it. It contains something from, we accepted something from Cuba's family system, family doctor system, and UK's national health system, NHS. But we are not copying. We are forming our own project for family health center according to our wish and according to our system in Kerala. So all the very old buildings were there for the primary health center, very small buildings, but we made a plan especially for primary health centers. But should be a public hospital. We said that the premises should be beautiful. A beautiful garden should be there in front of the hospital. And we enter into the hospital, there should be a very good reception. The patient or the bystander enter into the hospital, they can sit comfortably. So we insist that one by one, we give a chart. There should be some airport model chairs in the reception. So we decided to improve the primary health center to make it a family health center, making all things different. And in the immunization should be in a very good hall. And there should be these cartoon paintings on the wall, and there should be it should be child friendly. Oh, so we made it like that. And the clinical practices also we improved. There should be a nurses checking area first, pre-checkup area, and there should be some clinics especially for the to check the non-communicable diseases, Shwas clinic to check COPD, Ashwas clinic to find out the mental health of the village people. So many things I am not explaining. And we improved the staff strength also. Instead of one doctor in a PHC, we give 3 doctors. 3 doctors and more nursing staff, and there should be a very good laboratory. We build laboratory for the poor people there, and a pharmacist, a lab technician, everything we created. The post we created and distributed. First time we took 170 hospital to change first phase. Second phase, we took 500 hospitals and we have 946 primary health centers there. Now more than 800 hospitals changed to FHC. It was a continuous process and we are doing that. I'm not explaining. In the secondary sector also, we prepared a detailed plan for Taluk Hospital. There were so many small buildings here and there in the premises, and we demolished that buildings and build new these more several storied buildings for the Taluk Hospital. Very good operation theatres and reception, everything, and casualties also. We make the casualties up to date as emergency medical care unit. And in district hospitals and medical colleges, we decided to have the triage system. In the total trauma care project we started in Kerala at that time, and we studied the trauma care in AIMS Delhi. And with the helps of the doctor, I invited these two doctors from AIMS to come to Kerala and assist us to convert our casualty to a very good trauma care unit, national level very good trauma care unit. And they came to Kerala to help us, and we built the casualty with the triage, operation theatres, etc. So we were improving every system. That time we started the cancer strategic action plan. Same time we started some SDGs to eradicate TB, eradicate leprosy, etc. Separate teams we formed for that, And one team is to reduce child mortality rate. We cannot reduce child mortality rate simply saying to reduce it, but we have to implement something. We studied in 2016 onwards, we studied what is the matter. What is the cause of the child mortality? Then we found that 30% of the child mortality is due to congenital heart defects. People are by birth they are getting some difficulties in their hearts. If we can operate the child at once, within days we can save that child. But for that operation, the family cannot remit the fees. It is more than 6 lakhs, 8 lakhs, etc. So we started a special mission for that called Hridyam. And we started an office in Trivandrum especially for Hridyam. And all the 14 districts we have district offices and separate ambulance for that. And we declared that the treatment, the operation will be free to everybody. Without the discrimination.
9 lakhs.
Yes,
Operation
everybody
is
free. For even rich, because we want to get it reported. That is the issue. And all the delivery points we insisted, or we trained people to find out whether the newborn have congenital heart defects or not. At once they will report to the Hridyam office, and they start their work at once. Our ambulance will go to the place where the child and mother is, and picking them up to the hospitals where they get operated. I think only 4 or 5 hospitals have these facilities. At that time, no government medical college have this facility, this pediatric cardiac surgery. Now we started, After that we started, but we asked the private hospitals to help us. And I directly called the management. And I said that we will give some money, but not the fee as you decide. We will give 1.5 lakhs or more, up to 2 lakhs. That much we can give to you according to the condition of the child. So they agreed, and in Amrita Hospital, Little Flower, Aster Mims, Lake Shore, all these hospitals, Richitra also, they agreed to have this operation. And now more than 12,000 young ones get this operation in Kerala.
Great.
So that we started this in 2017. When we examined the result in 2020, we found that the mortality rate, child mortality rate, reduced from 12 out of 1000 live birth to 5 out of 1000 live birth.
Oh,
Fantastic result
great
of our this work, and it is below. It is now below the mortality rate of USA. Can
USA.
you believe?
Oh,
In
USA.
USA it is 5.6.
Oh.
In Kerala it is 5 out of 1000 live birth.
Oh,
2020 it become 5. Now it is continuing. Even after COVID it didn't increased.
Hmm.
It is become stable, you know.
Hmm.
That is the result of our work.
Oh.
That we are proud of that, because of the hard work, because of the good team and good implementation, because of the government's policy, we achieved it. Not only this, more result. I can't explain everything.
Ma'am, one question. During these 10 years, in central government there is BJP. Are they supported you? Are they given funds to you? Are they helped you? Or
They are not giving proper money to us. For example, every time we have to struggle with the central government to get the National Health Mission fund, their government share. While I was minister, always I have to go to central government, and my officers to go to there to get the money. Every time they are saying that you are not providing utilization certificate, etc. That is a must. We should have to produce utilization certificate, and after the struggle we are getting that money at that time. But now I think they cut short the money, the central share. They are not giving it properly, and the budget share of the health sector is also very low. Our government is spending below 2% of the GDP in health sector, India as a whole. It should be increased.
how
At
much
least
in Kerala?
that share they are giving to Kerala, but Kerala is adding
In
something.
Kerala budget,
Yes.
how much you are spending?
We are. I think it is more than 20%. You know,
20%.
20%, including this work. I'd say the capital investment, etc. And also we have a corporation, especially for buying and selling, distributing the medicine throughout Kerala. Kerala Medical Service Corporation Limited, and I think more state now implemented this kind of corporations in India. I don't know which state they are implementing. So through the KMSCL Medical Corporation, we are purchasing medicine and sending it to our hospitals. Government hospital below poverty line are getting free medicine, but above poverty line they are not so rich. They also are coming to the hospital. Now, as you ask first, the patients coming in government hospital increased their lot. 2016, only 33% of the population were coming to government hospitals. But when we improved the government hospitals and these operation theatres, very good casualties, and new equipments and good laboratories, imaging centers, etc. Even the rich people are coming to government
I've
hospital.
seen that.
Yes, they are also coming. We cannot deny them. But we have to get some money from them, and we are charging them in laboratories and imaging centers affordable charge, not according to the private hospitals. It is very low than the private hospital. So the hospital development committee is getting some money out of that. That money we are also implementing or using for the hospital administration and to give the poor people very good treatment. Our slogan, our CM always was saying that we should give the quality treatment and we could give affordable treatment to the poor people. We are trying our best, but the money we are getting as tax share and budget share from the center, that is not sufficient. I think you know that the central government is giving only below 30% of the tax share. Our federal system is like that. All the states are giving taxes to the
To
center,
central, yes,
and
exactly.
central government is giving share to states.
States.
That is the federal system. If it is a democratic federal system, no problem. They should give at least 50 or 60% of tax back to states, because it is the duty of the states to implement these things, giving treatment, giving education, free education, proper transport for the poor people, pensions, salaries, etc. That is the responsibility of the state government. So we should get more than 50% from the center. But they are saying that they will give 30%, but we are getting below 30%. With that money, how can we give free treatment for more people? That become a difficulty. But we are anyway here. We are doing that. We are struggling to do that. We must do that.
Actually, in Kerala, there is vast diversity. How you people, LDF government, protecting from communal forces?
Yes, Kerala is famous for secular mind, From the very beginning of the formation of state, I think in 1947 when we got independence, Kerala was not like this. There are caste differentiation, untouchability, and all forms of atrocities against the lower caste poor people. Princely states are there during that time, and we formed these linguistic states only after 50s. 1956 the linguistic states are formed, and 1957 there was election in the democratic country, and in Kerala surprisingly the left party won in that election. And EMS Namboodiripadu was the chief minister. Before that in Kerala there was caste differentiation and untouchability, etc. But when left government came to power, at once EMS ordered to have an ordinance within 6 or 7 days, stay of eviction ordinance. That means no one should be evicted from their land. No landlords can evict a poor people from the piece of land. So the poor people who have little hut in the landlord's land, they were every time they were afraid of the landlord. But after this ordinance, they stand still and they said, no one can evict us from this land. This is ours also. And after 1967, the second left government in Kerala, we decided to have the Land Reform Act, giving the landlords 15 acres of land. All the other thousands of acres of land we added to the government property, and the surplus land we assessed, and we divided the land to the landless people.
Distributed.
Yes, distributed, and they got a piece of land, and that way Kerala become a developed society. No discrimination of religion should be there. We insisted, not only left party but the social reformers. Previously, Sri Narayana Gurudev,
Narayana Guruji.
yes, one religion, one caste, and one God. He said so, and there are so many poets and writers at that time, and they also started their propaganda against the caste differentiation. So the left parties and left ideologists, they took that slogan and propagated in our state, and slowly we become a secular minded state. We have Christian church in one place. Very next to it there was a Muslim mosque, and next to it there is a Hindu temple. No fight between them. But sometimes the Hindu communalists try to have some problems. 1970s in Talasheri, they tried to have some conflicts in Talasheri riot, it is said so, and some these RSS people intervened, and they said that a chapel was thrown from a Muslim place, Muslim merchant's place, to the procession of Hindus, That was a false message, and there was some riots. At once, our people, AKG asked at that time, AKG was there. AKG asked our comrades to intervene immediately, and our chief minister Pinarayi, he was young man at that time, and he himself went there, and the trade union comrades also rushed to the place and to get the communal peoples out and saved the poor Muslim community there. And after that, once in Marad, there was a riot, a Hindu Muslim riot there. At that time also, our party and the secular people, other secular people also tried their best to get rid of it. So in Kerala, it is not spreading. The communal things is not spreading. Now we are afraid of the thing that the communal ideology they are trying to trying to get the people in Kerala also. They are very cunning. They are not directly saying that they are communal, but slowly that propaganda of this Brahmin upper caste, not the Brahmin as a caste, but the mindset as upper class and lower class, and they are making ground. They are preparing the ground for the supremacy of the upper caste and supremacy of the rich, these landlords or the capitalist corporates in Kerala. Slowly, they are injecting this feeling that India is for Hindu, and at the same time, a small group in Muslim community is also saying the liberation is through Muslim, and we are fighting both this communalism there. Now Kerala is secular state now.
My final question is, LDF in history, LDF got consecutive victories twice.
Yes.
Is third time victory, hat-trick victory possible? Or
We all think, we expect that the people will give the third time, because ours is a different model, an alternative for the capitalist, this kind of the capitalist mode of rule in center. During Congress and during BJP, both they were following this capitalist ideology, financial system, that the liberal and privatization accident, the LPG we are saying like that, liberalization, globalization and privatization. And they are implementing that, not only raising the slogan but implementing this thing. That is why in India, our honorable prime minister is saying he will make India as the third great strong nation. The Japan will go below India, and India will become the third strong financial country in the world. What does it mean? I don't know whether our honorable prime minister intended to get rid of the poverty in India. No, the survey shows that 30% of the population in Bihar and this UP is extremely poor. They are not getting even one meal a day. They are starving actually. The Poverty Right Watch or like that, that organizations take the survey, and they said that this is the condition in the condition of the poor people in Bihar after 78 years of independence. When that kind of surveyed in Kerala, our extreme poverty was 0.7%. And we tried our best, government tried our best to get rid of that extreme poverty in Kerala. We asked the local self-government to have the survey who are the families. We got 60,000 families who are extremely poor, and we get rid of that poverty. We supplied ration cards to them, we build houses for them, and we are supplying food for the poor people who cannot prepare food their own because of some diseases, and they are living alone. We find everyone. That doesn't means Kerala become a rich country or middle class or like that. there are poor people in Kerala. The basic poverty is there in some places. Now our slogan is to get rid of that poverty also. The burden of the big loans and the burden of education charges, the burden of the some health problems, etc. are there. We are now trying to get rid of that also. So Kerala is slowly become equality. Our slogan is to make the people equal to access government's money and government's their procedures. So it is very difficult in a capitalist country to implement this kind of socialist mode of things. Very difficult, but we are doing that. So every time we are quarreling with the center to get the money. You think about the National Employment Guarantee Act, new act, VBG Ramji. What is the need to change that thing? We don't know.
Change it too.
Yes, we struggled hard during the first UPA government to get some guarantee or some assurance to get some work, Indian citizen. And we compelled the UPA government to do something. At that time, we were supporting them from outside. And they implemented a project called this NREGA. Later it became Mahatma Gandhi National Rural Employment Guarantee Act. Thousands of people poor people were getting job out of that and getting some money out of that. Very good program. But every time they were trying to stop it during Congress period and during BJP period, it became severe. At first time in our budget, central government's budget, there was 1,15,000 crores of rupees was allotted first. Now it become below 60,000 crores of rupees. So they decided to get the program finished. Now the new scheme, they are saying that
they changed Act to scheme.
They had a new act to destroy the scheme. The scheme is that they changed its name. They changed the name of Mahatma Gandhi, our national father, and made the name as Vikasit Bharat Guarantee for the Roskar, Ajivika, this guarantee, Gramin, and they become the Ram inside. Ram is not a bad name, but putting Ram only will not make anything good for people. They should do some good there as their own decision. So they are now saying that you are getting only the 60% share from central government, 40% state would provide. How can a state would provide 40% from this meager amount we are getting from the center? It is not possible for the states, especially for Kerala. It is not possible. So the central government is giving all the burden to the states. They are not taking the responsibility. That was our criticism. So everything is going like that. But in Kerala, we started more welfare measures and more very big projects also. We completed the Vizhinjam project, and we completed Kannur airport, and we completed the corridor for the industries, and we are building very good big hospitals in Kerala for the poor people, and good roads between Macadam and between Taring, the concrete, that BMNBC roads were built in Kerala during this tenure. And at the same time, we are increasing the social welfare pension. First time, E.K. Nayanar started the pension, and each LDF government increased the amount. Never the UDF government increased it. Never they increased it. During Umanchandi sir's time, they announced 100 rupees increase, but they didn't give it. Not implemented it. And when we came and again we increased the amount, and now it increased to from the previous 65, we increased several times, and now it become 2,000 rupees per month to more than 62 lakh families. Yes, we are doing that, and we are giving there is a protection scheme for, we announced just now, for the women, who are the housewives or working in the house. They have no other jobs, they are not getting other pension. That kind of women, we are giving 1,000 rupees each month. We decided we are collecting the name of that woman, and we will give the money soon. And for the youth, we are giving the Connect to Work scholarship. If a young student, they completed the degree and he is trying to get a job, he wants some bridge courses or some skill development program, he have no money and he is not going for that, but the government is helping him or her, giving 1,000 rupees per month to remit the fees of that thing. So we are giving so many things. We increased the Asha workers honorarium, increased Anganwadi workers honorarium, according to our facility, according to our treasury, we are increasing these things. So doing a large amount of social welfare works, at the same time big project like this airport, seaport, etc., and some big industries were growing there, coming, some people are coming and investing money in our infra park, in infrastructure development, we are doing there also. And 93,000 crores of rupees we invested through KIFBI in the capital sector, capital investment sector, you know.
You balancing what is schemes and development?
Yes, social welfare system and the our development to produce more and get some money, to increase our own this money, or getting more share from the this investment. We are trying to increase our own financial condition, to improve our own financial condition. It is not easy, but we are doing like that. It is entirely different from the central government's policy. Central government didn't listen to the poor people, but Adani and Ambani, they are getting more and more, and they are become multinational corporates and counting their money. Our prime minister is saying we are the fifth force now, and we will become the third third financial strong, financially strong country, fourth largest country, economy. Secondly, okay, we are not saying so. We have to improve the poor people, and we have to increase or improve the other sector also.
Yes. Thank you, ma'am. Last one personal question. Many people feels that had got Raman Magsaysay award very much privileged, but you refused that. What is the
I
reason?
don't know whether they selected me, but they wrote a letter to me that I was selected for that award. The Senate selected me, and with thankful mind I wrote a letter to them. I am so much thankful to you, and but I am not accepting this award because of some political things, because we discussed it together, and we thought that during that Raman Magsaysay's period, a great massacre was there for the left-minded peoples. But Raman Magsaysay implemented some social things also, social welfare measures also. We are not denying, or we are not criticizing completely these kind of things, but as a party member and Communist Marxist Party's Central Committee member, it is better to not accept that award. We think so, and I decided like that, and with polite manner and with thankful mind, I wrote a letter to them. Sorry, I cannot accept this award because of some political matter. The another thing, they are giving this award for the work during the crisis in Kerala. That is not my own work, it was a team work, and I was only the leader of the team. Then they wrote to me, we know this is a team work, but we are selecting the team leader for this award. But I said, for these two reasons, I cannot accept the award. Wholeheartedly, I am rejecting this award, forgive me. I wrote a letter like that, and I denied that award. It is correct, I am a communist, and I have to have some some policies or some kind of principles we have to follow, you know. So I followed this according to my left mind. I denied that award.
Thank you very much, ma'am. Thank you very much.
Thank you. Thank you.
This is the special interview. A small state, small budget, they are doing miracles. The miracle women is here, and thank you very much. And please share this interview to all people. Thank you very much.
Thank you. Thank
Thank
you.
you.